Okay, hi everyone. This is Dr. Lakeisha J. Cole, and just in case this is a personal documentary for me only, I'm taking notes about my experience. Okay, so today I had a general practitioner's appointment scheduled for a general wellness check. Like most people who are not fans of going to the doctor's office, fear of not hearing the best news, or just not good at practicing doctor's visits, which is different than actually taking care of yourself personally, the things that you have to do for yourself before having a doctor's appointment, such as lifestyle, health, and living. And so my shoe needs to be tied. So as most people know, when it comes to lifestyle and living, I eat well, I exercise often, I love it, I live it. I also try to stay on top of my health. I do admit that I don't like to be, there's positivity for me, the tree. I do like to admit that I do not like to be stressed and worried about my health. I don't like the idea of stressing and worrying about disease. I studied disease and health so much, so long, so many years dedicated to reading textbooks, internet, research articles about health and disease. So I do not like to make it stressful for me personally in my health. I like to believe that I use all of that as motivation for me to practice a healthy lifestyle and living and having balance, but not to just live in the space of negative stress over, oh my God, do I have a disease? Do I, like that? I don't, I can't. I'm very sensitive mentally to certain things, so I'm very strong, so mentally too, in a lot of areas. Some things that could be stressful and worrying for others is not for me. I have a very high pain tolerance too. But point being, I use health. I like to focus on health. I don't like to focus my attention on disease, and I try to do everything that I can in my lifestyle that is within my control to I don't want this to be on. Okay, so I just like to focus on health and prevention of disease rather than focusing on having a disease and trying to cure it or prevent problems. I try to focus my areas on proactivity. However, as I stated, I'm realistic, so I do have a balance. I'm aware of social activity and my space around me, the environment around me, and how it makes me feel, and what that means when it comes to living every day. What am I going to do? How am I going to live? How am I going to eat? If I have social activities, if I go to a party or girls' night out or some special event, how am I going to engage in that environment? If I'm depressed, I'm sad, I'm hurt, in mental, physical pain, how am I going to respond to life? What am I going to do? Am I going to have poor behaviors or what? So I just use my experience as an instructor, as a healthcare professional, as an individual to help me make the best choices in balance. So that doesn't mean that I live a perfect life, but in balance, when you combine all this, I really believe that overall it balances out. Now, on a spiritual level, I have belief and faith, and I am an unrealistic person. I believe in the supernatural. I believe in anything being possible. I believe in the things that we cannot explain. I believe in asking the universe, talking to God, speaking to God, living in a space of meditation, possible things happening, seeing things as possible, no matter if they seem it's never been done before. It's unrealistic thinking. Like I have that type of positivity, belief, and faith. And for me, I believe that I'm thinking as I'm walking. So I just believe that for every person in life, no matter where you grew up, no matter your place of origin on this earth, in this world, I believe that we all have to have something to believe in that keeps us positively motivated and inspired. And when challenges come in life and difficulties that we face, we're still able to believe, have strength, be strong, and look forward to a positive, blossoming future. So that's how I feel. That's how I believe. So there you go. Mental, spiritual, physical well-being, what I believe. Now, for me, I'm that person that when it comes to just living a healthy lifestyle in balance, living a healthy lifestyle in balance, I definitely feel confident in what I do. Like I said, I'm not a person who, although I've worked in a hospital, although I've worked in a medical office, although I've worked in the university and college setting for advanced learning and undergraduate studies as an instructor in public health and health sciences, I still am not a person who wants to just be in and out of offices, bouncing around. And it's not that. So I don't want it to sound disrespectful at all, because it's not. I just don't want to be in and out of... I like to have trees in my background, not wires. Okay, there we go. That's better. So I just don't like to be, in a space where I'm constantly focused on disease. And that might sound strange to someone, but I'm very passionate about health and living healthy, being healthy. I'm very passionate about that. So for me, I like to focus on bringing who I am as a person and a health professional to this individual body of mine. And I do not like to feel in any way that I'm focusing on the negative. I'm focusing on disease. All the diseases. When you, and other health professionals can attest to this, when you study disease so much, you start focusing on, sometimes it can become an obsession to you if you don't turn it off. It's like you think you have every disease that you've ever studied, or you know, you just can't take your mind away from it. And you have to be able to turn it off. You have to be able to have balance in life. And so, again, I like to just take into account who I am as an individual and focus my attention on living and not focusing on disease. Okay? I don't like to think about things. I don't like to be stressed. I do not like to be worried. And it just finds its place in my life. So anyway, moving forward, I had a doctor's visit today, and just bear with me, because I know that I'll be talking. I already speak in deep thought, so I do speak slow. I talk slow because a lot of times I'm thinking while I'm talking. I allow myself to process on purpose. Hopefully it's not too annoying, but I had a doctor's appointment, and I'm so grateful for the people who I met today. Every person that I came into contact with, and the energy that they gave to me, whether they did it on purpose, knew what they were doing, or just being themselves, or just being good at what they do, passionate, I just think I'm so thankful for it. I'm so thankful for each of them. Those that I was able to learn their names, and those who just, you know, offered their services to me, and we didn't exchange what their name was. Of course, they had to identify me as a patient, but I'm so grateful for their energy, because it really took me through my day. And I would say there's a part of me today that kind of feels a little saddened and disappointed, because just like I'm sure anybody who takes their health seriously, you know, when you believe that you live a healthy lifestyle, like you actually pay attention to how you eat, how you exercise, your sleep, your environment around you. And although not perfect and will never be perfect, you're cautious about it, you're aware of it, and you believe that you're doing what you can to be healthy. Not that you can prevent life from happening to you, because you can't, but you feel good about doing at least what you think you know and believe to contribute to having a more positive, beneficial, and healthy life, mind, body, and spirit. And I'm that person. And so to go to the doctor's office, or to just even know within myself that something is off, something is not in balance. How does that happen? How does it happen? Realistically, of course I know, because I explain it to people all the time. But for me, how does it happen? And like I said, for me, being in this professional space, I know me, and I can obsess and compulse over things and get ridiculous when it comes to myself, and just cause myself so much stress and pain and aggravation. So to be in a position where I have to maintain control for myself, and it's like I am disappointed, because I know how I live. And then I start getting in my head, and I start thinking about all the things that in life I feel could negatively contribute to poor health outcomes. And then I start talking like a scientist to myself instead of a human being. And that's how I really like to be a human being. That's why I don't really try to have my channel all epidemiologically, scientifically speaking. Not that, that's not what it is in life, but I like to use my channel specifically for just balance and enjoyment as a part of a contribution to my life and contributing positively to others. So I don't really want it to be like a channel based in scientific epidemiology. Let's go through some research studies. I don't want to do that, okay? I want to be in peace on my channel. So when I'm dealing with myself and my life, in order for me to turn it off, and like I said, I love everything about what I'm doing in health, but in order to just have a positive, healthy balance for me, I have to turn it off, because there are other areas in my life where it's never turned off. And I think about things like that, just like I said, to get into how do unhealthy outcomes occur. If you go to the doctor's office and you're considering every aspect of the human body, your genetics, your social behaviors, your nutrition, your physical fitness activity, your behaviors associated with drugs, alcohol, even natural substances that are taken in excess and able to produce unhealthy habits that have been studied and researched to lead to poor outcomes. So when you're looking at everything from a biological, chemical, environmental, social, behavioral, etc., when you're looking at all the factors that play a role in your health, how you grew up, what you experienced when you were young, how that affected you mentally, how that mental effect contributed to your health going forward, your decision making. Did past traumas cause you to engage in unhealthy behaviors? Did you eat poorly? Did you stay out all night? Did you lack sleep? Did you enter into an environmental space where you engaged in drugs and alcohol and other substances and abuse them as a means of self-treatment. You know, all these different things that affect every person. How do you handle things? Do you allow yourself to be in negative environments and just try to handle them? And then physically you look good, you look all right, you appear healthy, but mentally it's taking a toll on you that is changing the structure, which alters the physiological function of your body. And that can be picked up on examinations, tests that take an internal look at yourself. So for me, it's like if anything is abnormal, or I just, you know, I don't understand it. I don't understand it. I know myself better than anybody when it comes to like my internal mindset, how I think, what bothers me, when I feel good, when I don't feel good. And it's just a lot. But you know, I admit I am an educated health professional who, like, I just have a way of doing things and seeing things, and I don't like to, you know, I don't. Like I said, all of us, we're human. Everybody is like, don't be unrealistic. Don't be too whatever with yourself. Too over the top where you just are unrealistic. And I am that. And a lot of times I don't like to be in health professional settings where people are, you know, health professionals are talking about the patients, their family members, or situations like in that space. Not that they're not human and can't do it, but I don't like to see that. If I'm working someplace and I see that, I'm gone. If I'm a health professional in that space, I'm not having it. If I am working I'm not working, but if I'm a patient in that space and I sense that type of energy, I'm gone. Like, I let that drive me to making the decisions that I believe I need to make concerning, as far as like if I'm present or if I'm out of there. And now that I'm older, in my older age, I use all the wisdom that I know to come with me in making those decisions. Like I said, I've said in several videos, and like I said, this is a positive note for me too. I am working within a space where I don't care how people look at me. I don't care how people judge me. I don't care what their perceptions are of me, because I know who I am and I know who I want to be, and I know why I do things. I know why I don't do things. I know my experiences and the things that I have done that were not good for me, the negative motivations that influenced me to have poor decisions, make poor decisions, and the negative outcomes that it has had on me physically, mentally, how it influenced my spiritual walk. Just now being in a space where I'm able to say, this is what I'm looking for. Yes, this is how I grew up. This is what I experienced. But along my journey, how my life would end up turning, these are the individual experiences that I had that motivated and inspired me to make changes that I believed is best for me. And I operate in that space. I have a positive outlook on things. I know how I act, and I know in a lot of situations I can be a turnoff to people, because they can perceive me just by maybe looking at me or interacting with me in a tight space and just come up with their own conclusions. That's really not what I'm thinking or how I feel, but it's judged. And the same thing with other people now. I know that we're all judged. And that's why I know it is important for everyone to look at themselves and think, this is what's best for me. It may not be the most popular. It may not be what someone else wants from me. It may not be understood. It may not be appreciated. But I have to do what's best for me. And sometimes by doing what's best for me, yes, I have those internal moments where I cringe because I have to say no. I'm not going to do this. I don't want to do this. And I look at people who do things for me and with me, and I know sometimes they feel like just the general saying that we all have heard at some point, the way that we feel about ourselves and other people. When you do something for other people, sometimes in your life along your journey, you feel like, personally, sometimes you get an ego and feel like people owe you. You owe me because I did this for you. And if you don't, do something for me, it may not be the same thing, but if you don't do something for me, I'm letting you go. I'm through. I'm done. And it only stresses you because I've been there. That's why now I'm able to say no to people. If it's something, I weigh things individually as a person. That's how I look at things. I weigh them out individually, and I say to myself, I look at individual moments. And in this individual moment, is this best for me? Is this something that I need to do? Is it going to leave me mentally disturbed and stressed more than I was within the past 10 minutes, the past 24 hours, whatever? And that's how I do. That's how I make decisions. And it doesn't mean that I don't do things for people who have done things for me. It just means I select what I believe I can do for you. If I can't do something for you, I'm not going to stress myself to try to do it for you. And then when another area comes up that I'm strong and I can do something to help you, I'm going to do it. And I will go out my way to help you and do it. But, and then I just clear my mind. I don't even allow myself to feel bothered negatively by any of this stuff. Like, and as I said, it's hard. It is hard. I'm not going to sit here and say it's easy because it's not. It's hard, and it doesn't seem to get any easier. It's just one of those things that you make a decision and you go with that decision. And then as soon as you make that decision and you determine that it was best for you, immediately you clear your mind. And you don't worry about what anybody thinks, what they're thinking about the situation, what they're thinking about you, if they're talking about you or not behind your back. You just immediately clear your mind from thinking that way. Immediately. And then you just keep going on with your life. And you reset. You don't allow yourself to be negative around those people the next time you see them, the next time you talk to them. If they don't want to speak to you or have anything to do with you because of the last encounter that you had, then you take the same approach to that, which is you tell yourself that you did what was best for you, and you don't allow yourself to hold a grudge or hold any negative distance between that person and that situation. Don't allow your mind to keep focusing on it, because it's gone. Whether people hold it to 10, 20, 30, 40, 50 years down the road, after the decision is made, after it's done, it's gone. It's only left in your memory. It's only traumatizing you because you keep it relevant in your life. It is gone. You can never relive that moment ever again in life. You could take that action on purpose, intentionally, and do that action again. It still has a different date and time in your life. So it's not the same thing. And you have to use that to help you. Use it to help you improve and be able to let go of things and be able to move forward in your life in a positive manner and feel good about your life in spite of, because challenging times come for everybody. Difficult news, and stop for me and everybody else. It is so easy to judge people. Well, I hadn't talked to this person in weeks, and whatever, and I don't know what's going on. And then that person, they didn't tell you, but they done had surgery. They're not, and that's not something that they're going to share with you. So sometimes I've learned there are just things that people are not going to tell you about their lives that will, if they tell you, it'll give you a positive explanation about why you haven't talked to them, or why you're feeling so negative about your relationship with them, or why they went this long without doing this, and why they know better, and this and that. All of it, whatever it is, people have things that they do not disclose. They just don't share with you, and it will help you understand. And you do deserve an explanation, but you're not going to get one, because everybody has the right to keep certain things about their lives private, whether it makes you have a nasty attitude or a negative feel about it or not. Nobody has to tell you something, even if it's something that honestly is like, okay, you owe me this. I'm your spouse, I'm your parent, I'm your child, I'm your co-worker, I'm your best friend, I'm your this and that and the other. I'm sorry, but as an individual, it is a person's individual right not to go into anything that they don't want to. There will be consequences, and that's still a part of life. The consequences of not doing that, the consequences of choosing to do that, to share everything, to not share things, a person's perception of its value, of importance, its significance, all of that. But it is a part of life. And we all experience times of joy, times of peace, times of what we think is unfair, undeserving, hurtful, challenging, hard, difficult. Not something that we want to experience. We both, positive, negative, good and bad, up and down, we all experience it. I know we want to sometimes isolate ourselves and make it seem like we're the only people in the world who go through things. And sometimes we'll even speak that people go through things, but then we won't give ourselves or them the grace to know that they might be going through something. Maybe that's why you hadn't heard from them. Stop thinking that people are mad at you because they take some time for themselves. I know with me, and like I said, I use it all the time to help me feel good about life. A lot of times I'm not mad at anybody. I'm not upset. I'm not bitter. I'm not angry. I'm not operating in unforgiveness. Sometimes I just want to be to myself. And if I'm dealing with people who feel like, okay, well, when you don't want to be bothered, when you contact me or want to spend time with me or be around me, I'm not going to be bothered with you. That doesn't upset me. it does not upset me, because now I'm in a space of life and time where I totally understand that that's how I do. And I give myself a chance to be at peace or in grace with others and myself. So I'm just, you know, all I can say is I have some things that I have to take care of and I have to deal with as an individual. And typical for me, you know, I will be making decisions moving forward about what I feel is best for me. And that includes some obligations and different things, responsibilities, or not responsibilities, but just new tasks that I've taken on. You know, if I feel internally, after examining my energy and about it, and taking thought about it and being sensitive to my spirit, if I believe that it's not good for me to continue on with these things, I'm going to put them down. And, you know, it'll just be the same decision that was made last time, but for a different reason. And again, it will be led and guided by what I believe is best for me. And if people want to talk about me or feel bad about it, then that's just something that's going to come with it. I've learned now to be okay with myself about that. Life happens to people, and everybody's different, and people make different decisions, and they're not always the decisions that you would make if you were them. So I'm going to end this documentary because either I'm getting ready to finish working out or I'm going to be taking it in. Dr. Lakeisha J. Cole, in case this goes public for me. I'm out.